Welcome to Startup Health Now, the podcast where we share stories from the front lines of health innovation. I'm Nicole Clark, Startup Health Senior Writer. The month of March has come and gone, and here we are in April. I don't know about you, but the last month has felt more like a year. As each of us navigates the impact of the novel coronavirus on our lives, our individual day-to-day adjustments have added up to a seismic global shift. Now, many of these shifts are nothing short of devastating. The fatalities, the job losses, the overburdened health systems, and in many countries, a deepened divisiveness across political lines. At Startup Health, our aim during these trying times is twofold. One, to foster a space for rapid collaboration around COVID-19. And second, to hold space for stories and insights about the health innovators mounting a pandemic response. For us, fostering space for collaboration looks like this: a COVID-19 navigator. This week, we launched an online search tool to help organizations easily find solutions for coronavirus-related challenges. We're calling it the COVID-19 Navigator because it's designed to drill down to market-ready tools that can have a direct impact on stopping the spread of the infectious disease. Anyone can use it, and by virtue of its openness, it can help bring together companies, investors, patients, and partners from around the world for a coordinated pandemic response. You can find the tool on our website at startuphealth.com. Now, to my latter point about Startup Health holding space, here's what I mean by that. Our media team has been covering the coronavirus since early March. We're doing our due diligence to stay up to date on the latest news and scientific research so that we can offer up insights on solutions for challenges related to the pandemic. This episode of our podcast is another example of that. Today, you're going to hear from a health entrepreneur who has created an affordable telemedicine platform that is direct to consumers. Direct to consumer meaning after listening to this, or perhaps while you're listening to this, you can download their app, make an appointment with a physician or medical specialist, and if needed, get a prescription written. All for $10. Doesn't matter if you have insurance or not. The telemedicine platform is called Rejuvenan. The $10 covers a subscription fee and to have a customized wellness plan created for you. Your first visit would be a quick wellness checkup, conducted over video or the phone with a physician, and it's free. From there, you can schedule a sick care video visit with a doctor to address a health concern or to get a prescription written. Here's what's unique, though. On Rejuvenan, the more you engage with your wellness plan, the cheaper your cost of care becomes. For example, tracking your steps or how many glasses of water you drink in a day can earn you dollars that can be put toward your care cost on the platform. At a time when we're being directed to practice physical distancing or to shelter in place, Rejuvenan's healthcare model has the ability to meet us where we're at and to free up hospitals to meet the growing needs of COVID-19 patients. Now you're probably thinking, too good to be true. I thought that too, which is why I reached out to someone who used it recently.
Hi, my name is Amy Sandu.
Hi, Amy. Thanks for the quick call. So what prompted you to use Rejuvenan?
Well, I was not feeling so great, and I'm actually out of town at the moment and was very worried about going and sitting in a urgent care facility waiting for a doctor for, an hour, who knows how long, with everyone's health scares currently. I looked up on Startup Health's website to see if there was any, telemedicine type companies available, and I found Rejuvenan and was very excited. Got on. I was a little bit worried because I'm not the most tech savvy. I didn't know if it would be an issue joining video conferencing or anything like that, but it was an incredibly easy platform to use. Sign up was easy. I received an email probably about an hour prior to the appointment reminding me, and I got an automatic join notification on my phone. I clicked accept, and immediately I was talking to a doctor. I couldn't believe how quick it was, how easy it was. The doctor was very thorough. I was very grateful for that. I kind of expected it to be just tell me what's wrong, okay, bye. He asked a lot of questions, wanted to know a lot about my health, and I was very, very happy with the appointment itself, and was quite shocked when not even an hour later I got a phone call from the pharmacy saying you have a prescription ready.
With some of that upfront explanation about Rejuvenan and a quick example of how it can work, take a listen now to this interview with Rejuvenan CEO Rishi Madhok. He sat down with our Chief Medical Officer, Dr. Howard Krein, at the 2020 Startup Health Festival in January for a fireside chat. In their talk, they unpacked the brilliant tech and medical data that went into making the app. And Rishi shares his ultimate vision to drive the cost of healthcare to zero. Take a listen.
Well, thank you.
Welcome. It's exciting to have you here.
Yeah, no, absolutely. Second time, so it's different this time around.
I know. So I'm going to start off. I just wanted to because I think it's an amazing thing for those of you who don't know Rishi. Started off in emergency medicine,
Yep.
Right? And I always find this amazing as an emergency medicine doctor. But you were also an expert in blockchain. How does that even happen?
Mostly by mistake. I'd love to say it was a stroke of genius or an epiphany. It wasn't. My interest had always been in technology while I was in residency, while I was in my training. I'd done a lot of work in tracking patient populations and looking at different databases and how we interact with different databases and communicate information. And at the same time, I had friends who had gone the startup route and engineering route and said, have you heard of this Bitcoin, really, is how I got into it. And the two are different. And they said, listen, you should check out Bitcoin because there's a fun way to play online called Satoshi Dice. So it's not a very glamorous start, but that led me down this rabbit hole of understanding the technology of how this currency was transacted, how it was accounted for, and how it's also distributed and unlocked. And so that started, me down that path years ago. And I had tucked it away for a little while as a hobby and interest while, developing my first company around telemedicine, and brought it back as I sought a way to create security as well as accessibility around data and incentivize that patient interaction. So that's how it all came together for me.
Okay, and is that where is BitMed came from that then?
Yep.
Directly?
So my prior startup health company was BitMed, and we delivered a telemedicine product domestically and internationally. And we sought to subsidize the entire patient interaction at no cost, based off of data sales, de-identified data
At what
sales.
cost?
No cost.
Yeah.
And so we fully subsidized primary care, preventative care, women's health, even had started down the path of mental health, through just de-identified data sales and that entire process. And we leveraged blockchain to be able to incentivize to be the conduit for data transaction while rewarding our patients for participating in that interaction as well.
That's amazing. So what would you say to the people who say, you can't drive the cost of healthcare down to zero?
Well, I have about 100,000 interactions that are pretty wrong on that one.
I love it.
So that was a nice accomplishment. And that led me to discovering Rejuvenan and Fred Nazem.
Which is an amazing, another really interesting story, because you're doing your own thing with BitMed, and then just can you explain first off for those who don't know who Fred is and what he was doing and how you guys, this whole conference is really about collaboration and how you guys sort of got together and decided to merge.
Yeah, absolutely. So Fred Nazem was the co-founder and then CEO of Rejuvenan Global Health. He had a long track record in healthcare, has a long track record in healthcare.
He did.
Having just celebrated, I think, his 80th birthday, and I don't think he'd mind me saying that. But his track record, dates back to starting the earliest VCs out here on the West Coast, having IPO'd 3 companies that he helped co-found as well, and been a part of 60 other IPOs. He turned around Oxford Health and has led to its value creation since. And so he has been a cornerstone in healthcare and its development.
He's legendary.
Exactly.
I mean, he really is. He's legendary in healthcare.
And so it was an honor to meet him. And he and I actually met at Columbia, at a conference at Columbia where I was speaking. And Fred and I sat down for coffee. I admittedly did not know everything about what I just said. I just said, seems like an interesting person to talk to. And we sat down with coffee. And he described Rejuvenan to me there. And he said, I'm looking to create a way for people to access their health that 95% of the time that they're well. Yeah. I want to be able to engage with them in a personalized, accessible manner on their terms. And I've created this platform and this experience along with a score to help them create an objective score around their health, founded in science, and then execute on that score for a sense of betterment on their terms. And I was a little bit awestruck at that moment because that's the pitch that I give for BitMed, just from the other angle. My angle was always, we started BitMed to create personalized, accessible healthcare, by driving all the barriers down to zero, starting with cost. And so we wanted you to think about your health, to think about BitMed, but we engaged it from the sick care side. We had a team of physicians, a medical practice that covers the entire US, and at that time international as well, that would allow you to talk to us, address your primary care, preventative care, all those goals, and then get you engaged on your health from there moving forward.
Right.
I realized for BitMed, one of our struggles was we become problem-focused. And the success that Fred and Rejuvenan had is they are people-focused. They're focused on the person, not just their problems. They're focused on what are their needs, what are their goals, and most importantly, as you find when you engage with consumers in health, what are they willing to do?
Yeah.
That is another driver. Because if you create a plan as a physician, right? If you create a plan, they take the statin, go run 5 miles, and you're going to do great with your cholesterol. Then they go home and pop some Big Macs and never run again. You just lost. It doesn't matter if you had the right plan. That wasn't the right plan for the patient or for the member.
So I want to so when you go to the Rejuvenan site and you download your platform, right? That's one of the first things it has you do is answer a bunch of questions, and you come up with this sort of combined score that is a generalized health score, right? Mm-hmm. And it's all based on basically Nobel Prize true scientific data, right?
Yep.
And reproducible and trackable.
Yes.
And that's, I think, right, that's the power of this, is you can actually follow your progress and you can follow the patient's progress. One of the things that I'm amazed at, and that it fits right into our driving the cost down to zero, is what does it cost the patient?
$10.
Every time they come on?
So it's $10. You pay a $10 subscription fee to have access to your experience. You have everything planned out. Your initial wellness visit is free or included in your subscription.
Yep.
And if you need to do a sick care visit with one of our doctors or one of our specialists, it's $10.
Yeah.
No insurance. We're not, it's no hidden fees. There's no markup. It's just $10. If you engage on your health and you engage in your plan and participate, you can drive your cost again back down to zero. You can earn our Rejuvenan reward points to subsidize your physician visits or other goods and services in our marketplace.
Stop and think about that for a minute, right? You have access to physicians, to people to help you to stay healthy, or if need be, to get healthy, and the cost can be driven down to zero. I mean, it's revolutionary, and I mean, we're just proud to be part of your journey on that. But it's an amazing. It really is an amazing thing. So how do you get once you get patients onto the platform, how do you keep engaging them?
Absolutely. So it actually starts, what we learned initially with Rejuvenan is, you have your health score, which is 10 biomarkers that is based on that telomere science, right? Those 10 biomarkers have 3 unique traits. One is you can do them all from home. You don't need to go into a lab. 2, they're immediately relevant to medical practice. So just as it's important to our health score, it's also important to tell your doctor about your A1C, your systolic blood pressure, how much you're drinking, your activity, et cetera. So it has that relevance there. And the third component is it directly relates to the elongation of telomere length, which is what was shown to prevent or improve morbidity, mortality. Adding length to your years and quality of life to those years as well.
Right, and that is a malleable thing. You can actually, even though many people say, "Oh, we talked about to this with Dean," is what does health and diet and exercise and changing the lifestyle do? But that actually can affect the telomere length, and you really are increasing longevity, right, and health.
And so what we do is you get that score. That's your set point. That's where you're at. You're 67. You're 78. That's okay. That's where you are. And then there's a risk detection and treatment engine that starts driving this personalized experience for you. That is, where it really starts. Well, we added in a layer over that with the acquisition of BitMed. We introduced what's called the initial wellness visit. This is that no-cost wellness check. So when you come on, I don't really want you to answer any questions. I just want you to schedule your appointment. Let us do the heavy lifting, because that's how you get people to care about their health. It's too much to ask people for more once you've had them sign up. It doesn't work. What does work is giving people something of value when they sign up. And most people today cannot sign up to a service and schedule an appointment with a physician who's going to end with a team that's guaranteeing they're going to be with them throughout their health journey. So that's what we offer right when you sign up. And that's what's gotten us our adoption and really gets people going. That's that primary engagement. Now, once you're on the platform, that risk detection and treatment engine, that's driving an experience for you. So if you would, and so let's say for me, I could probably do better with my nutrition. Actually, I know I could do better with my nutrition because Rejuvenan really made me quite aware of that. And so my weakness is apparently high glycemic foods. So I get notifications.
I think it's all our weaknesses.
Exactly. But I get timed notifications to when I'm going to make my decision as to what I'm going to eat today or what I should pack for lunch. Should I have that extra snack before bed?
Yeah.
The app engages with me in a scalable manner because that's the artificial intelligence. Sometimes you need more than just you and a robot.
Yeah.
So we have user communities, people with you on the same experience to reach out for support, for information, things that you may not discuss with a doctor because we don't know.
Yeah.
It may just be outside of our respective scope as to what's the best grocery store local to me to buy this type of organic food. That's a community question. And then finally, that care piece of having a physician at any time you want. You can do consults on demand, and you can schedule them if that's better for you as well. So that's how we start that engagement, through behavioral nudges, notifications on the app, our own chatbot, a really personality to the platform, as well as live human user communities. My opinion is that the best mix to engage in healthcare is the right mix of human touch made scalable through technology.
Right.
The technology should fall behind everything else. Our users don't know about a blockchain. They don't need to. No one cares. Our users definitely don't know about the artificial intelligence because no patient cares about your algorithm. What they care is that is this service, is this experience about me? Is it relevant to me? And does it trigger me at the time when I'm going to make a decision? Mm-hmm. And that's what Rejuvenan seeks to do.
So with a cost model that's so cheap inexpensive, to take good care, preventable care, right? Because that's sort of going back to what we've talked about with HLI and with Dean. So much of this is prevention, right? If you can get your hemoglobin A1C down because you're getting reminded, hey, maybe skip that extra, like you said, high glycemic meal or snack, or hey, you haven't exercised in a few days? Maybe go for a run or stand up at work.
Or in a point for exercising, right? Sync your Apple Watch and go get that mile.
Exactly.
Yep.
So as you move forward, where do you see Rejuvenan sort of settling in the healthcare system? Is it something where you think that health systems are going to start to do it? Do you see it by itself as a preventative medicine tool? Do you see insurance companies saying, hey, wait a second, they're doing what, they're actually helping us reduce morbidity, maybe we should partner with them?
Yep.
Or all of the above?
So I see Rejuvenan's platform and experience as, if you will, a bit of health navigation. This room is filled, right, with companies that have created brilliant solutions, right? But solutions don't matter if your patients don't know, if people don't know when to get to them and how to use them.
Yeah.
That's where we've fallen off in healthcare. What we're able to do is, we offer our own solution to help the patient get started. We bring in partners that we vet, and we provide solutions to them that are immediately relevant for them. So if you need that de-stress, improved sleep, you have diabetes and hypertension. Let's bring in the right services. If we have them or if a partner has them, let's bring them in. Yeah. If you do a consult with one of our doctors, and listen, not everything can be handled over telemedicine. If we need to hand off care, then we want to hand you off in an appropriate manner. Let's find the right health system under your insurance to provide you with the best possible experience, both health-wise, but also address your personal needs, financial concerns, timing concerns, et cetera. When we look for partners now, we see, our deployment, we have two primary business channels. One is what you'd expect a B2B2C, where we work with insurance companies, we work with, employers to provide our service, to their members. Yeah. But we also have a strong B2C channel. This is what we started, since the BitMed acquisition. Because at the end of the day, whether it's an employee or it's just a person who saw an ad, it's a person using your product. Yep. They need a community. And Rejuvenan is a movement. Yeah. And so we want to create that. So we have social media influencers. We have other brands working with us to sponsor giveaways or sponsor, create brand awareness and interest to make it actually enjoyable and positive to engage in your health. Yeah. So those are the two channels, and we engage with partners on both.
Yeah. I was going to say, what an exciting time, because as you mentioned, as you increase the companies that you're partners with, as technology and data improve and provide you with more data points that you can actually be focused on, right, in your overall score, it's just going to get more powerful and more powerful.
Absolutely. It's interesting as I was listening to the last speaker speak about data, I couldn't agree more. Yeah. When you talk about population health and cohorts of data, but people in and of themselves are little treasure troves of data when you can engage with them longitudinally in a structured manner. And you can actually drive people, on how to engage in a predictable manner with their health and provide a service around that brings honestly back the magic of technology. Yeah. When someone logs in or doesn't even log in, but gets that alert at that moment in time to help direct their behavior to produce a tangible outcome for them that they were willing to do, you just won. Because they feel like they did it, and they also feel like, hey, this app knows me, this service, Rejuvenan knows me. Yeah,
and it really is an amazing thing. I know we're running out of time, but just when as a physician, I was always, and I don't want to say skeptical, but you're like, will people really adapt to little reminders on behavior? And something as simple as on the Apple Watch, the take a deep breath, that you get pinged every once in a while. And at first I was like, what's this? And I would just turn it off. Then I was like, well, let me see how it does. And it really does. It's a small lifestyle modification, but I think it does relax you, de-stress you a little bit and say, oh, okay, let me get back to my day. It's not intrusive, and I think that the benefits can be absolutely amazing. And I think that the other thing which you had touched upon, which is this is really a combination. People don't understand that population health and personalized medicine are actually really intricately tied together, that you can't have one without the other. Yep. So I think we're out of time, but thank you so much. I'm so excited to watch Rejuvenan grow and continued success.
Thank you so much. Thank you for having me.
At Startup Health, our motto has been, Together We Can. By uniting a global army of the world's top health innovators, we believe we can solve the world's biggest health challenges. This includes challenges like the one we currently face, with the spread of the novel coronavirus. We invest in entrepreneurs who are committed to achieving health moonshots. And to read more about the inspiring women and men in Startup Health, go to startuphealth.com and click on content. I appreciate you joining me today. Tune in the rest of this week for special programming from our very own Chief Medical Officer, Dr. Howard Krein, along with dispatches from 2 Italian health entrepreneurs working to keep hospitals safe and expedite testing in Italy. Meanwhile, stay safe, stay healthy, and do your part to practice responsible social distancing. We're all in this